Even for a person of faith, I felt total hopelessness. I felt abandoned by God.
Whether one has faith or doesn't have faith, it doesn't make any difference. Depression is something that can affect anyone.
About 10% of men and 25% of women at one point or another during their lifetime will experience a depressive disorder.
Today's program is about depression, and we're going to let people tell their stories. And we're going to listen to persons who are professionals in the field of depression. And we're also going to hear how people have found hope. Susan Gregg Schroeder is an associate minister at First United Methodist Church in San Diego.
So I will be.
I had a number of symptoms that came on gradually. I didn't enjoy things that I used to. I had difficulty concentrating. I was nervous. I couldn't sleep. I couldn't eat. It was very, very difficult to concentrate on anything. And I didn't really know what was happening. I felt sort of split apart. And at the time, my spiritual director realized, he is also a therapist, and realized that I was exhibiting many of the symptoms of depression and brought that to my attention. I ignored that and denied that, and of course nothing's wrong with me if I just pray harder and longer, have more faith, I can beat this. And it did end up that I had to go see a psychiatrist who happens to be a member of our church, which was one of the most humbling experiences of my life. He did recommend hospitalization and medication. I did not tell anybody. I was so full of shame and just the fact that I couldn't handle this myself, that I didn't know what was happening to me. When he recommended a hospitalization, I said I would rather be dead than go in the hospital. I had visited parishioners there, I had done worship services there, and suddenly I was a patient. And when I was signed in, and that first night was just so strange for me. I didn't ever sleep. I just walked the floors wondering, what am I doing here? What have I done wrong? Just full of shame and a great deal of guilt, and just not understanding why I was in this place. And yet something deep inside knowing that I needed to be safe and I needed to be in that place.
Psychiatrist Matthew Zedimer frequently treats depressed patients in his San Diego-based practice.
Depression is a psychological, physiological illness that's characterized by a persistent blue mood, but not just the everyday blues that all of us experience from time to time. Clinical depression lasts for a much longer period of time, and in addition to the blue mood, the individual experiencing depression may experience sleep disturbance, either consisting of difficulty falling asleep or getting up in the middle of the night and having difficulty falling back to sleep. They may find themselves becoming much more irritable than usual, becoming angry with their wife or their children. They may find themselves becoming more anxious with a persistent level of anxiety. They may also develop an appetite disturbance, and that can take either two forms. It can be either a loss of appetite or actually an increase of appetite. Many other people also complain about a loss of energy and a loss of drive.
Pastor Richard Elliott has experienced two major depressive episodes in his life.
I would find myself unable to concentrate. I would find myself sort of daydreaming, staring at the wall. I thought I was accomplishing things, but I really wasn't. And the second time, I certainly was aware of it, and I was aware that it was affecting my work. The first time, I wasn't aware that it was affecting my work, and I wasn't aware that other people saw this, but they did, and they're the ones that told me about it.
Decisions, little decisions like what clothes I'm going to be wearing today, become extremely difficult decisions for the severely depressed person to make. At times they will take to bed and find themselves unable to literally to get out of bed. It's not uncommon that the depressed person wakes up in the morning and although they may have slept through the night, feel like they've been run over by a truck and have no energy.
It was a symptom for me, for my depression, was a feeling of helplessness, a feeling that I really couldn't do much about my situation. Or I didn't feel motivated, perhaps, to do anything about my situation. I felt maybe responsible for it.
Depression can also take a tremendous toll on patients' friends and loved ones. Few people know this more than Ron Reich.
Depression is a very difficult thing for someone to watch because basically all you can do is observe and hold and hope that it's going to come to an end. You can only be there. There's very little that you can actually do to make the depression significantly better for an individual. Depression is something, unfortunately, I've been hit with 3 people that mean a lot to me. My oldest son, at the age of approximately 16, we noted was having significant symptoms of depression. And fortunately, we were able to recognize these symptoms and be able to get him some medical help. This even resulted in hospitalization for most of his junior year in high school. He did very well initially in terms of recovery, was able to finish his high school year, and then went on to starting college. But the depression returned, and in spite of hospitalization, medication, the pain was continuous and too much. And when the pain no longer could be tolerated, he committed suicide. My first wife, John's mother, also was depressed, and it was very painful to watch someone have such a difficult time doubting everything. I can remember her struggling with trying to decide which of 2 cans of soup to open. Such a simple thing as that can be an overwhelming decision to make. The third person who's affected me with depression is Sunny, my wife, and she's been battling this problem for approximately 5 years now, including 2 hospitalizations. And it's been extremely difficult, again, to be with someone you care about and love, and be very helpless to be able to do much in order to make her feel better. Fortunately, she's been responding to medication.
We don't really completely understand what causes depression. There's a lot of good scientific data that indicates that depressive illness may be caused by a change in neurotransmitter chemistry within the human brain, but we don't really know exactly what causes it.
We all have times of darkness and despair, but depression is very much different. It's deeper and it lasts so much longer. And there's the feeling that you'll never get out of it. I think that very much often there is a spiritual element that accompanies that feeling of total alienation, of hopelessness. Even for a person of faith, I felt total hopelessness. I felt abandoned by God. And so it very much for me was a spiritual issue.
I think depression in our society is extremely pervading. We seem to be in a world that is in chaos, and with the so-called downsizing where people are losing their jobs, that they are, and relationships are rupturing, there is much depression. This was a tremendous impact to me as I began my role as the parish nurse, and I realized how very hurting people are, not only in this congregation, but in the world at large.
Many people with depression suffer in secrecy for fear of how others may react.
I did have 2 subsequent hospitalizations. I kept very quiet about it. Most people did not know. Certainly the congregation did not know. Some of the staff knew. But mostly I was so full of shame that it was not something I wanted other people to know about. And I kept that burden of silence. I would, even when I was in the hospital, during my break time or during my time when I would be allowed to have a pass, I'd come to the church and prepare newsletters for my groups and sort of keep up this pretense of everything being normal. And everybody said, "Oh, you look so normal, everybody seems so normal. We had no idea you were going through this." If I would have had cancer or something else, they would have surrounded me with love. But instead, the church supervisors and the hierarchy didn't really know what to do with me. There was discussion that I should be put on involuntary disability, which I was already dealing with issues of rejection and abandonment. And if for my church to abandon me would have been the ultimate rejection and abandonment for me. For some people, they may need to be on leave, but the church needs to be sensitive to what the needs are of the pastors or the parishioners and not just make a judgment. I needed to be involved in work. It's what kept me going.
I would say that most of the thinking today would indicate or believes, including my own, that we don't really have a cure for depressive disorder. I think there are those individuals who may have a single depressive episode, may receive treatment, and never have another depressive episode their entire lives. And I suppose you could say that that individual is cured. Generally speaking, the data shows that if an individual has had one major depressive episode, their chances of having another one are about 50%. Once they've had 2 major depressive episodes, their chances of having a third increase to 70%. And after 3 episodes, you can almost be certain that they'll have at least another one, if not several more, during the course of their lifetime. So I think probably, unfortunately, the most reasonable way to look at depressive illness is as a chronic illness, kind of like high blood pressure.
And I feel that our culture, wants to move people out of depression as fast as you can, get the medication, get this, get that. And those are very important, but it has to be treated holistically. The hospital setting, I was only treated clinically. I was not treated with the spiritual problem or with anything else. And so it took me finding that in therapy, choosing somebody who was a minister, pastoral counselor, to be able to bring that aspect into my own healing process.
I've been a parish nurse here at the church for the last 1.5 years. That's when I started. And my relationship with Reverend Greg Schroeder became one of collegiality, and I was aware that she was dealing with some issues and they were becoming more burdensome, and with her we decided that she needed to break her burden of silence, which she did, which took quite an act of courage, I might add.
So I did write an open letter to the church, and I explained what depression was, that I was struggling with depression, that I had been in the hospital. We have all these groups for 12-step, AA, and all these things here that we offer at the church, but depression still has that stigma. And it was just like people came out of the woodwork with their own stories. And at that time, our parish nurse set up a information evening on depression, which we had a turnaway crowd. We started a depression support group now called the New Hope Support Group. But mostly I felt this tremendous release of finally being out with it.
The church, yes, does have to address this issue. It's one that we have sort of swept under the rug, as society has. And I see this as my role as the parish nurse, to say this is a health problem. It is an illness, and we must deal with it like we do the flu, or when we stub our toe, or any other illness that can befall us. And I think this is a powerful ministry that we can offer to people.
It was hard for me to recognize that it might also be a medical issue and that God also works through doctors and medications.
There is certainly a variety of treatments for depressive illness, and one of the tragedies I think today is when someone doesn't get treatment, because we have a variety of treatments, most of which are extremely effective and many of which have very little in the way of side effects. There are a variety of psychopharmacological or medication alternatives for the individual who is depressed. Up until the late 80s, we did have some medications available to us. Unfortunately, some of them had significant side effects that in some cases almost made the treatment as bad as the illness. Starting in the late 80s, however, there have been a variety of next-generation antidepressant medications that have come on the market that are really terrific in terms of being effective in about 65 to 70% of the cases of depressive illness, and also have relatively few side effects.
I'm reluctant to take medication, but I tried many different medications and they didn't work. When I finally found the one that was right for me, it made such a huge difference. And then I was able to work on the spiritual issues, the psychological issues, the other issues. But I needed the combination.
I think it's important also to mention electroconvulsive therapy, which actually, although it stirs up all sorts of very horrific images in our mind, actually is the most efficacious treatment we have in treating very, very severe depressions, and also tends to be relatively safe in terms of side effects. There are some problems in some cases with memory loss, but probably the biggest problem with electroconvulsive therapy, or ECT actually, is a fairly significant rate of recidivism. That is, the individual tends to get depressed again sometime in the future. The other non-somatic treatments of depressive disorder include psychotherapy. And in fact, there's an excellent form of therapy which we call cognitive therapy, which was developed by Dr. Aaron Beck, which specifically was to develop to treat depressive illness, and is based on a model of rethinking our thoughts and reprocessing our thoughts, those negative thoughts and those ruminations principally that I was alluding to before. What Beck has found, and has been indeed substantiated by others, that if some individuals can actually change their thought patterns, that actually their mood actually improves as well.
If you are feeling that you have the symptoms of depression, it is very important to seek help. And unfortunately, the studies have shown that often our clergy are the least helpful. And many times the family practitioners or the family doctors are not knowledgeable in depression, and they will diagnose it as something else, give you a medication, but not see the underlying cause as being depression. And so I would say that if you are feeling that you are dealing with issues of depression, or a loved one is, that you need to be persistent. If you don't get help from the first person that you go to somebody else. You need to be an advocate for your own health and spiritual well-being.
For people who are struggling with an individual who's depressed, you need to get your battery recharged, because the person that you're struggling and working with and loving and hoping they are cured or will be cured really can't give you much in return. So you do need to have an ability to tap into your resources for strength. And don't hesitate to ask. Put yourself in that situation. If one of your very close friends or loved ones was hurting and they asked for help, you would volunteer and be there in a second. They'll do it for you as well.
The spiritual aspect of depression, I think, is again very, very powerful. I think this is why it's important for anybody to have a faith, not necessarily a church or a religion, but a spirituality where they feel connected to a higher power, that they are oftentimes not in control of what's going on in their lives, but they have somebody, a friend, who we call God, and that is important, that they are not essentially alone.
In my own case, I felt that some of the factors in my life over which I should have some control, I didn't seem to have control over, and but my faith helped to sustain me in that situation, because God sets us free from the need to be in control. If you have a need to be in control, there's a sense in which you have a need to play God. And that is the very opposite of having faith in Christ or in God. If you have a need to be in control, then you don't allow God to be in control of your life. And but once you recognize that you don't need to be in control and that you can turn your life over to God, then you are comforted by that.
The Psalms have always been very powerful for me. They are laments. And if you read the Psalms, the whole aspect of being in the dark night of the soul, the depression, being in the darkness, is very evident there. But there's also this really feeling of not being in the dark alone, especially Psalm 57, of being in the shadow of God's wings. And that for me became a very powerful image, that even when I felt like I was alone, I wasn't alone, that somehow in the darkness God was there. Creation was formed out of chaos, and we're so afraid of chaos, of darkness. But those can be opportunities for growth, and if we will stay with the darkness long enough, there are wonderful gifts that God has to give us in the darkness for us to learn in our own spiritual journey.
It's no fun being depressed. In fact, it's a pretty miserable illness. But the good news is that we have some excellent treatments that are relatively benign in the way of side effects, and there's an enormous amount of hope if the individual gets treatment.
Even if I should fall into the shadow, the deep shadows again, I have a sense deep down, I think, of hope that I am not alone and that I will be able to make it through that, which is something I didn't have before.
Well, we're back at the altar of First Methodist Church. The stories that we have heard are really helpful, aren't they? Depression is a difficult disease with which to live. And if this altar stands for anything, it stands for the presence of God in life. Your life and my life. And let's not forget that. There's hope because of that.